welcome back to the State of Healthcare podcast, or the SOH as we're calling it. Last season, we learned about things from the health provider's perspective. So we learned about our system and kind of some of the frustrations of why it's not necessarily broken, right? It's just doing what it says. We treat and treat. We don't necessarily try to prevent illnesses. We don't try to be proactive for patients. So unfortunately, what we've led to is a system that's not necessarily servicing or providing the actual care that it's supposed to be doing in the first place. This season, we're going along from the journey as the patient perspective. So I'd like to kind of combo. If you haven't listened to season 1, always go on back. But what we're going to be learning is what can you do as a patient? So here we're going to be exploring various conditions, some common, some not so common, and what the people have gone through on their journeys from here. So join us this season as we learn what you can do as a patient to take your own healthcare into your hands in the state of healthcare. Hi, and welcome back to another episode of the State of Healthcare. We are still going through our journey of discussing where patients are at. So we're welcoming Julie back, and you've heard her from season 1 talking about the healthcare practitioner side of things. But as in most things, we're also usually patients too, and we've been through the system. So most healthcare workers kind of understand the system from both ends. But so I'm going to you have a varied history and things like that, but I'm going to kind of let you talk me through your journey.
Awesome. Okay. So yeah, I was on season 1 talking about my experience as a nurse in the healthcare system. And Tracy and I have talked about a healthcare journey I've been on for actually most of my life with arthritis. And I'll take us way back. I'm 61 currently. And when I was 13, I broke my left leg, the 2 lower bones in my leg, the tibia and the fibula. We call those the tib fib. And I had osteoarthritis almost immediately from that. Just that left hip was never quite the same. And this was in 1976. So I think things were a little different. There really wasn't PT. People just patched you up and said, enjoy your life. And on we went. And, no big deal. That was the standard of care at that point in time. So I've had osteoarthritis almost my entire life, and that is pretty common in my family. And osteoarthritis for me tends to show up as some pain, some discomfort. I don't feel it really impacts my range of motion just because of what I do, because I'm a yoga instructor and I do a lot of yoga classes. But I would say it's a little bit of an uphill battle. So that was where my journey with arthritis. I like to say I'm an arthritis warrior. That's kind of where that began way back in the 70s. And then in 2012, I was told I had rheumatoid arthritis. And so this was a different type of arthritis. Osteo, we are having our joints wear down, if you will. And typically you wouldn't see osteo in a child like I was, but I had a break, and then things heal a little differently. And again, there really wasn't physical therapy. That was just the way of the world. So rheumatoid is an autoimmune disorder, and in an autoimmune disorder, and these are very common in our culture. I can't speak to the whole world, but certainly in our culture, autoimmune is very common. And also typically once you get one autoimmune, you'll get another. Right. So it was I think I said 2012, but I believe it was actually 2010. I think I misspoke there. And they told me I had rheumatoid arthritis. And asked me, did I want to start seeing a rheumatologist? This would be someone who specializes in this. And I felt fine. I was like, no, I don't need to see a rheumatologist. I'm good. So I kept going to the doctor, and every year when you go for your annual checkup, do you want to see a rheumatologist? Do you want me to refer you? I'm good. In 2018, this is my path. I'm not saying you should do this. I stopped going to the doctor because I just got tired of, you have rheumatoid arthritis. Can we refer you out? No, I'm fine. I'm good. And I do say to people, honestly, the first 10 years were no big deal. I just flew right through it. Everything was good. I'm on 14. I'm in my 14th year, and definitely I can feel some things. I have some discomfort. But for me, I still believe that movement and diet are what are going to make the difference in my life, rather than going to get some medication. Medication will relieve my pain,
Mhm.
but to commit to that, I think medication always has a side effect.
Mhm.
So for me, I decided I'm going to just do movement. I'm going to watch my diet and see. And I do know the things that will trigger me or flare me
Mhm.
are gluten, um, sugar, and I feel like there's one more: gluten, sugar. I'm not sure what the other one is. I don't drink much alcohol, so maybe it's alcohol,
It could
which is
be.
basically sugar.
Well, and when you say flare, like what are your
Mhm.
symptoms with a
Oh,
flare?
yeah, good question.
Mhm.
Okay. So when I have a flare, I can have several symptoms. I can be fatigued, very fatigued.
Mhm.
I can have discomfort. And then as I've gotten farther into this journey, I can also have GI distress, which is
Okay.
common for rheumatoid arthritis. So if
Right.
I get all three at the same time, I refer to that as the trifecta, that I'm having a trifecta.
Right.
When I first started to flare, I would not be aware that I was going into a flare because it was new to me. And it starts always for me with fatigue, where I feel like I've had plenty of sleep. Like, why am I so tired? The more I live with this disease, and you do live with it, right? So we're going to figure out how do I find a way to live with this? What am I going to do? Because my choices I've made are not to do the Western medicine, not to do
Mhm.
medications. And again, if it's working for you to do meds, I would not ever tell someone you have to do what I'm doing. This is just my
Just
individual
your
path.
personal story.
Yeah, this is my path.
Mhm.
So as soon as I start to realize, like, wow, I'm really fatigued,
Mhm.
I will try and do things like not drive, because that's a lot of sitting. Tracy knows what I do for a living. I drive all over the place.
Yes.
I try to get more rest. So I'll try and take what I can off my calendar.
Mhm.
And literally, I will say, okay, I'm going to just sit down. I'm going to be more relaxed. I'm going to make sure I'm drinking lots of water, get plenty of rest. And that does tend to work for me. Interestingly, we are in what I refer to as my flare season, the spring. Like once we get through the holidays and we start, it's the end of February here in Arizona, but it's spring for us. So once we get through the holidays, I don't know exactly what it is about this weather, but this is when I am most likely to flare.
Interesting.
When it's really hot, I'm good. Like
Oh.
our summers here, 120 degrees, no problem. I just fly right through that. Pretty good with the fall, but once I hit this weather, it's like, oh, this is when I'm gonna flare.
Okay.
If
So
I'm
all
going
this,
to.
all the nice weather people come here for, you're like, no.
I know, exactly.
It's interesting. So as a PT, when people come to me with osteoarthritis to start with, a lot of times they see it as like not a death sentence, but I have a lot of panic, right? I have arthritis or, this and that. And I feel like, I don't know if it's just it was just sort of like people panic, I have arthritis. And I feel like these are conditions that I spend a lot of time being like, you will live with this the rest of
Oh,
your
yes,
life.
absolutely.
And here's
Yes.
now the changes you have to make. So that's as you're talking about, like, like these are the weather conditions that will probably
Yes.
lead to flare-ups. These are the things that I need to do. And on a level, you're like, why do I have to make these life changes? And I know people are like, this sucks a little bit. But I think the biggest thing is knowing your triggers, right?
Yes. Yes, exactly.
Making a plan and being okay with that I have to make these life adjustments.
Yes. And honestly, for me, if I realize like I'm going into a flare, it is hard for me because I love to be busy. I love to move. I love to do things. So for me to say, what can I take off my plate? And then literally, I just get comfy at my house. Like you can sit in the easy chair. I can sit on my bed. I do tend to sit with my legs up. I tend to be very supported, like I'm in a supported shape. I'm not sitting at a kitchen chair with a stiff back and my legs hanging down. I tend to have my legs up. Arthritis is tricky too, because the longer you sit, sometimes the more things hurt.
Yes.
So if I have to stop moving, you'll see me like, I'm going to sit here for a while and then I'm going to go outside and do a little bit of walking around in my yard or doing a little bit of work in the garden, just something easy. And then I'm going to come in, I'm going to sit somewhere different. So I do have to sort of find that I can't just lay down and stay down for several days. That's not good for me either.
Right.
So, and each person again is unique. So
Right.
it would be finding your individual patterns. I'm sort of fascinated that people think osteoarthritis is a death sentence.
You know, it's interesting because again, it's terrible. And it's also, I love my father, but he always lectures me because osteoarthritis is again, usually there's an injury or there's wear and tear, right? So it's usually one side of the body. It's like one particular joints, right? Like for me, like I have some in my neck, I have some in my hands, and it's like degeneration, right? It's I call it living. This is what happens when you live, you wear things down, right?
Yes.
But people come in and my dad's like, it's because I have that arthritis. I can't do this. And he breaks it down for me. And I'm like, Dad, if you had been moving and doing the right exercises and things, we can prevent that. And usually like people wake up and they're like, but I'm stiff for a little bit. And I'm like, yes. You have that's a normal thing with osteoarthritis or like basically some form of degeneration. When you first wake up, you feel it, you move around and then it gets going, right?
Yes.
And that's okay. Like it's terrible as it is. I'd love to leap out of bed and be like, "Pada!" But like you get up, you move around and you get it going. So I do find that I find a lot of time educating people that like it's okay. Now what we are going to do, we're going to keep you mobile, we're going to keep you strong, and then we're going to prevent this from becoming more of an issue.
So to your point, on Monday, I taught a class at noon here at the studio, and a woman who was new told me at the end of class, she said, I have rheumatoid arthritis. And it was the end of class. And I said to her, so do I. And her eyes just got really big because she just watched me do this whole class. And because she was asking, will this help? Yes, absolutely. And it is hard because I understand why people say it hurts and I'm not going to move. I'm just going to curl up and I'm not going to move.
Right.
But I say, I don't know, like, will I ever be able to move again if I stop moving? So I feel like I have to keep moving. I probably said that in our first thought as well.
I'm obviously like very pro movement. Like I feel like this year's theme has been for me, like first get moving, but also be like conscious of your movement.
Yes.
Like don't just fling yourself through things.
Yes.
Like we even in our theme for class today, like it's okay to slow down,
right?
But you still keep moving. So you take a pause break, but you're intentional with your movements. But again, I think that is part of it, right? It becomes this, I call it like all these cycles, right? If you stop moving, then you hurt more, then you don't want to move, so now you're laying there more, so it just spirals on itself. Whereas if you kind of push through that movement a little bit and be like, it'll be okay.
Yes.
Then you can keep going with the thing.
Yes. And that, to your point, I will rest. And then I'm like, well, I'll go out to the garden and I'll pick snap peas. And that's right now we have snap peas that are blooming and you have to go out almost every day. They just grow so fast. So I'll go out to the garden and I'll do something like that for a little bit. I'll go out to the garden and I'll check on the hens. How are the hens doing?
Right.
Do I have any eggs to gather? Just something small like that, just to go out front, check the mail. It's literally small things.
Right.
Wipe down the counters in the kitchen. I mean, I'm not like, I'm going to go run a mile or anything. I don't do that. If I'm in the middle of a flare, I'm going to just move, just do activities of daily living, and then sit back down.
And that's a big thing for me. Even the days when I wake up and I'm exhausted and I'm like, I don't want to exercise or I just want to lie here. But once I can kind of push through that, even like the mental block of it, the movement, I feel like just keeps my body. It's just getting over that initial barrier. My question for you was in 2010, when they figured out you had a rheumatoid, were there symptoms that led to that in the first place, or why were they investigating?
It was blood work. It was blood work where they're like, you're flagging as rheumatoid arthritis. And so it's interesting because I never would go to a rheumatologist. So a primary care will say, yes, you have rheumatoid arthritis. I can see it here. But because I wouldn't go to a rheumatologist, they won't write it. They won't officially give you the diagnosis. And now that I'm self-employed, I would be uninsurable if I had that. So our system is not necessarily set up well for wellness. And my husband says all the time, how'd you know not to do that? I said, well, I was in healthcare. I knew, don't do it. Don't go down that path.
Pre-existing condition.
Yes. Yeah.
Okay. And that's the horrible part, right? Like you've got all the things, but had you gone, and again, I have a bunch of patients with autoimmune disorders,
Yeah.
everything from fibro to lupus to, and then they go through this rheumatology system. And again, we already know I have some of my own healthcare system issues, right? But they're trying to swim and do the things that they can, but there's these conglomerates of or rheumatologists associating out here, and you have to go like, I know this is kind of a random rabbit hole issue, but there's been this big association that's swallowing up all the rheumatologists out here. And then if you go to one of them and get started in this group, you're not allowed to switch to another doctor in that practice.
Oh, wow.
You have to stay with that one.
Okay.
So it's also kind of like a hard journey for these poor people that are trying to navigate and get, so it's
I didn't go down that rabbit hole at all, but I had decided I was not going to take the medications. So that's every time a primary care. And honestly, I think I had 8 years of visits where they said, do you want a referral? Do you want a referral? And I was just like, I'm going to stop coming to the doctor. Literally, I stopped, which again, I'm not saying that's the answer.
Right.
But I knew I wasn't going to take the medication because that was not what I wanted to. I did not see that as my path to wellness.
Right.
And so for me, I'm like, why would I see a rheumatologist? What are they going to give me? You've already told me I have this, so I know I have this.
Right.
And I have to figure out how I'm going to work with it without those drugs. So there was no reason for me to go to a rheumatologist.
I also find it interesting because you work in healthcare, right? So
I know.
to be like, you're like, you want to go to this doctor, okay. And then I also feel like sometimes we're the most skeptical, where they're like, you need to go here. And we're like, do I? So I find it interesting that a lot of healthcare workers are usually the ones that don't. Like, we're like, we'll figure it out on our own.
Well, I think there's two kinds. So I always say, you've got the healthcare worker that's like, I have a hangnail and I need a specialist. And then you've got the healthcare worker like me, where someone says, you have 2 broken bones in your foot. And I'm like, I'll be fine. I'll just walk those off. It's no big deal. Like, I'll be careful, but I'm okay. So you've got that wide range, and you're right. And some people will just say, oh, okay, I will go to the doctor that you referred me to. We definitely, so this is going to take me down a little rabbit hole. So as creatures, we are naturally intuitive. And I say to people, if you and I are hunter-gatherers and we started our journey in Queen Creek, and now we've arrived in Phoenix, and we're hunter-gatherers, so it's not, we don't have a city here. And as we move from Queen Creek to Phoenix, we are gathering food to eat. We're walking, so we have to figure out. So when we come upon new types of food, we have to decide, is this safe to eat? Is this food? Is this medicine? Is this toxic?
Right.
And if it's something brand new, how do we know that? Well, some of it is my intuition. Some of it is looking at things and intuitively feeling like, I probably don't want to eat that because that looks like the mushroom someone else ate and then they died, kind of thing. And also our intuition of, should I go in that cave? Caves are shelter if we're hunter-gatherers, but we feel strongly like I shouldn't go in that cave. So we're not going to, even though it's shelter and it's raining and I need this. We are no longer intuitive creatures. We have been taught to listen to authority. The medical model is an authority. You have rheumatoid arthritis, you should go to a rheumatologist. You have this, you should go here, you should do this. The rheumatologist says you should take these meds. And again, I feel like if that's your path and that's working for you, I support you, because I don't like this shaming and telling people I'm right and you're incorrect, because we're all on a different path. But for me to say, I don't think so. And when people say that to me, but you're a nurse, I'm like, yeah, you should think about that. You should think about the fact that nurses often are like, no, I'm not going to do that. Because we're looking at it from the inside and saying, I don't want to go down that path.
Because you maybe have seen what happens.
Yes.
Too.
But some nurses will be like, I do want to go down that path and this is my path. And so I feel like the medical model is one of our models in this culture that discourages us from being intuitive and listening to, if I'm not listening to my body, how do I know that I'm going to go into a flare? How do I know what makes me flare? So I have to really pay attention. I was just thinking when I was saying foods, sugar, dairy, gluten, it just came to me, it was dairy.
Dairy is the other one.
Dairy I just have to, there's some dairy that's okay and some that's not. gluten is my absolute worst. Gluten will make me cough, and it's like literally my body's like, do not eat this.
Okay, so your body automatically just telling you.
Yes, don't eat this.
And
Yeah.
that's a little bit even with so rheumatoid is a tricky one because it can attack both sides of your body.
Yes,
There are
absolutely.
the deformities of people's joints that you
Yes.
see. I mean, you get some with osteo, but you can have your eyes affected, you can have your GI system. It affects. So the hard part with an autoimmune disorder is it attacks multiple systems,
Yes.
right? Like if I have osteoarthritis of my thumb, this is my thumb. This is where it's
Yes.
going to be. This
Yeah.
is what it's going to live for the most part. It may start affecting other joints because I'm making weird compensations, but an autoimmune disorder is going to attack. So that's why it's always important. I'll have people like journal or try to figure out
Yes.
patterns
Yeah.
with their flares and things like that so that we can figure out what,
Right.
even not just activity stuff, but and that's why like maybe some people do need medications. Maybe it is attacking
Absolutely.
part of their
Absolutely.
system, so.
And also I just feel like it's okay to say, I don't want to figure this out on my own. I want that assistance.
Mhm.
So I really look at let's support each other in the choices we make in healthcare. And as we said at the beginning, this is my unique journey. And
Yeah.
it's not one I would say to people, oh, you have to do it this way. It's, do it the way that works for you, for sure.
But it's interesting you talked about how we go to an authority figure. And so
Yes.
I look at my parents, right? When my dad had all this stuff happen with him, and my mom was like trying to navigate the system. And she's like, the doctor says I have to do this. The doctor, and they're following these things. And I'm like, what? And so I'm over there like, no. Like, here's what we're going to do. If they send you somewhere and you're not liking it, you have choices. You
Right.
don't have to go there. We're going to do this. We're going to find the best healthcare and the best pathway for him that works for you guys. And so now it's interesting watching my mom kind of like fight for what she wants or what my dad needs and like try to listen to the things, and like take care of it. And it's kind of been interesting watching her journey or like trying to figure out the system because it was just always the doctor told him to do this. This is what they did, right? The doctor said he had to take this medication. They went, got that medication. And now, now she's questioning a little bit more and kind of like, wait, is this what so I feel like a lot of people do just blindly follow a little bit because it is an authority figure. That only applies if you're not listening to your physical therapist. Like if I tell you, you blindly follow. But anyway, but like that's always my rule. I'm like, if I tell you, like I expect, but again, and I don't want everyone being in there like Tracy says I have to question my doctors, but not every pathway. Like again, even for PT, right? I'll have two patients with the exact same diagnosis, the exact same diagnostics, but they're going to respond differently. So I can't cookie cutter their treatment. I have to tailor it to each patient based on their personal experience or where they're at or what works for them or how their body responds. So
and I think it is finding that provider that really you feel like I can communicate with this provider well. And I had a PA who was my primary and I just loved her. And she wound up going to a holistic orthopedic type of clinic. I don't really know where she went, but she was amazing. And so I was seeing her one time and I don't know if I had allergies or what I had. And she was saying like, I could buy Sudafed. And I said to her, oh, I'll just use the neti pot where you pour the water through your nose. And she was like, oh, I would much rather you use neti pot. But, I think practitioners are also in a situation in our culture where someone comes in and I probably said this in the first pod too. So if, for 30 years I sat around, I ate fast food. I just was an armchair warrior, just kind of hung out all the time in my armchair. And then I show up and the doctor's like, well, you have, your heart needs work and this, that, and the other. And you want a quick fix. Like, well, what's the pill? What are you going to give me? As opposed to, you need to start walking, you need to start eating better. That's harder.
Right.
So I think our providers are also often in that situation where her first thing to me was take Sudafed. And I was like, oh no, I'm not going to go get Sudafed. I'll just use my neti pot.
Right. Which is.
Yeah. So she and I were a great match. And in fact, when she left, that was part of why I was like, I'm just going to quit going to the doctor. I loved her. She was amazing. But she did ask me every year if I wanted to go see a rheumatologist.
Right.
I was like, no, I don't. But again, I think with the system, they're like, this woman has RA, rheumatoid arthritis. You have to offer this. You have to give this to her. And
Well,
No.
and that's also, I do feel bad for, again, the nice part about being cash pay for me is that I then can make the decisions and offer the advice that I would do. There are things
Yes.
you have to do to cover your butt, right?
Yes,
So if
absolutely.
someone comes to me with certain symptoms, I have to say, you need to seek a physician, you need to do
Yes.
these things, right? Just from covering my butt from a liability standpoint.
Yes.
But because I'm not working under an insurance plan, I don't have to check a box and say, oh, you have this, you have to, did I offer these 5 medications? Or did I
Right.
do this?
Right.
Because I take Medicare, I have to ask these questions. So because I don't operate under that system, I can then treat based off of like what I actually think would be the best
Yes.
thing for
Yeah,
that particular
absolutely.
patient. So I always try to tell patients to be a little kinder to their providers as they're trying to push statins on them or make them do this, because the doctors have to check boxes if they want to get
Yeah.
paid and if they want to
For
stay in
sure.
business. And
Yeah.
that's also not my picking on the rheumatologists who have all conglomerated together to survive, to be honest, in this healthcare system. So maybe they've made this giant conglomerate, but they have to do things to actually pay their bills.
Yeah, absolutely. Absolutely. If you're going to get
Mhm.
reimbursed from insurance, you do.
Mhm.
Same in a hospital. Hospitals like, did you offer everyone a flu shot? And
Mhm.
insurance is even going to look at what percentage,
Uh-huh.
so you're going to get more
Yeah.
money with a higher percentage.
Mhm.
So it's tricky. It
And
is
it's also
tricky.
interesting because you have these like, again, I feel like they set these standards, right? Because you want everyone to not be sick, you want everyone to have good hand washing, you want everyone to have whatever. But then sometimes I'm like, who's this person setting these standards? Is it someone getting paid by the pharmacy company? Is it someone like, I mean, I want good quality care, but like I was like, who set these standards? Or, even I had times when I was trying to justify things for patients on the phone and I'm talking to this person and they're like, I needed something for a low back thing for a patient. And they kept asking me a question about something that would be offered for the neck. And I finally was like, I understand you're just checking boxes. I need a person on the phone who understands anatomy so that I can actually get what my patient needs.
Right,
But
right.
you're just going down a form.
Yes.
You're the bottom person going down a form. I'll escalate this call because you don't understand anatomy and you're not understanding what my patient needs.
Right.
Yeah. So it is interesting, but I feel like people don't always get that. They're like, why does my doctor do these things? I'm like, they have to do this to survive.
Sure. Oh, sure.
So
Yeah, and you do have to
Mhm.
advocate for yourself. And some
Mhm.
people are good at advocating for themselves, and some people are better to have someone else come in and advocate for them.
Right.
My sister's best friend is a guy who's in his 50s, and he has a very lengthy health history. He's had a couple of heart attacks, he's had his hip replaced, he's had, I want to say, 4 kidney transplants. I mean, he has a really significant health history. And he is the nicest guy. And so he will just sit there when they come in. How are you doing today? Fine. And if my sister's in there, she's like, he needs a bath and he needs to get up and we need to change his clothes. And he will look at her like, stop it,
Right.
But I feel like he does need all those things. He's told her, I need these things, but he doesn't want to. And it's okay. He doesn't want to advocate for himself. But so if we're in that role, then we maybe have to pull someone in with us who is going to speak up on our behalf and help us get through this. Yes.
I do feel like there's a need for a medical advocate on some level because
yes.
a lot of my patients will go to the doctor and they'll be explaining all these things and they have no idea what they're saying. And the doctor's got, 20 other patients that are hurrying. And so then you're trying to write and they don't know what to ask for, what to fight for, these, and it's just,
Yes.
and then they're like, I don't know, they said all these things, even for me, like for some things where I've had to go in, the doctor's like, da, 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 and I'm like, hold on. I understand you got 20 other people. I have these 3 questions. Break it down for me.
Yes. Yeah.
And because I'm like, I get it. I get you're like, let's
Yes.
go.
Yeah.
But like, and they've made their decision and they're moving on to the next person or whatever. But it is so hard because even with having a medical background, I'm like, whoa, 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 whoa. Like, I need you to break this down.
Sure.
This isn't my area of
Yeah.
expertise. So a lot of patients are just in there and then they're like, oh, this happened. And then they get shuttled out the door and they don't even know what
Yes.
happened.
Well, and it's going really fast and the physician is busy and they are an authority. And I'm with you. I'm like, I worked with physicians most of my career, so I'm the same way. Stop. But I find that physicians will stop and tell you when you say, hang on, I need this answered.
Right.
But also you do have to be clear. So when people come in and they're all over the place,
Yeah.
it's challenging because you are asking for that physician to figure out like, what is my problem?
Right.
And figure out how you're going to be treated very quickly in a very short period of time. So for me, if I present with rheumatoid arthritis symptoms, but I'm all over the place, the answer is we're going to send you to a rheumatologist.
Right. And have them break it down.
Yeah, because someone has to break this down. And it is tricky if you go in and you're saying like, my stomach hurts and I have to keep clearing my throat. I have that all the time.
Right.
And my back hurts and my hip hurts. And I couldn't sleep the other night because I was thinking all these random thoughts. And the physician is like, whoa, okay. Like, and they will come back to like, what bothers you the most? Like
Right.
what? And for me as a nurse, when I would triage and
Uh-huh.
someone's all over the place,
Right.
what brought you in today? Tell me why you're here today.
Right.
And if they go again, I'm like, we need to focus. Like you can have multiple, my body hurts, my ankle hurts, my hip hurts, this hurts. But then if I'm going to get into, I'm clearing my throat, my stomach hurts, like what bothers you the most? We're going to focus on what bothers you the most today. And then we'll go from there.
Right.
And I think to that point, the PA I had, PAs and probably nurse practitioners have a different caseload than a physician. A physician is overseeing PAs. A nurse practitioner can be an independent functioning practitioner. But so that can also be something where the physician's like, look, I have this huge caseload. So we need you to focus where someone else, a PT or a PA or an NP might have a smaller caseload.
And they
so
might have more time to do that.
Yeah. And I feel like I've gotten amazing care from that particular PA. I just loved her. I adored her. Yeah.
Well, and that's also, so as terrible as it's going to sound when you go in as a patient, not that you have to prioritize, but it does help to be organized. I always tell patients to come in with your list of questions, make sure you get the main ones. Even for my mom, like when she goes with my dad, I'm like, make sure these are the things you have listed. Bring this information with you. Be organized. As terrible as it sounds, make that practitioner's life a little easier.
Yes.
Even as a PT, like I'll be working with people and then I'm like, okay, great. We're doing all these things. And they're like, oh, I forgot I also blah, blah, blah. And I'm like, oh gosh, and I'm like, we've just spent an hour trying to, and maybe that was information I might've needed at the beginning.
Yes.
So like review, as terrible as it sounds to be like really weirdly organized, but like review before your appointments, make sure you have your list of things, and stuff like that.
Yeah.
Even trying to help some of my patients when they're getting like their loved ones to the physician, I'm always like, make sure you ask this, write your questions down, do these things to help you. Again, it's fighting for your healthcare, but it's also making that practitioner's life a little easier to help them like get you what you need.
Just thinking of that. So one of the other hats I wear is yoga therapy. And sometimes I'll say to a client, we're in the last, 5, 10, 15 minutes. Is there anything we haven't covered? And they drop the bomb, and you're like, okay. And I do feel like, oh my God, why didn't we lead with this? But I think sometimes people need to know, do I feel safe? Do I feel safe to tell this person? Because yoga therapy can be both your physical issues and other issues that are going on. So it can be, do I feel safe enough to tell them this big? Yeah, because I am shocked sometimes where I'm like, and then you've got that, like, keep your face nice and calm and like, okay, well, let's talk about that. And, trying to figure out how am I going to be therapeutic for this massive situation you just dumped on me? Like, is it safe to let you go? Do we need to reschedule? And I had one person tell me something, and I think she told me she'd never told anyone. And I think she told me because she knew she couldn't reschedule with me. This is when I was doing the training for yoga therapy. And I think she felt like, I'm just going to tell her because I can't follow up with her because she's done. And I've never told anyone. And I think she just felt like I have to tell someone this.
I can release it.
Yeah.
And then I don't have to deal with the things after.
Yeah. And I did work with her, but just for a few minutes, but I was like, wow, it was so big. It was such a big thing. And so sometimes, and I do think she just felt like I'm safe and I can release, I can lift this burden. So obviously I still think about her.
Right. Yeah. And that's hard because then you're going like,
I know. Are you okay? Like, do I need to come back on? And do we need another session?
And then even from therapy, even for physical therapy, like we'll do this whole session. I'm like, okay, and I'm racking my brain. And then they're ready to leave and they're like, by the way. And so maybe it is it took that time for them to
Yeah.
feel safe, which is fine. But then also I'm like, oh no, like
Yes.
that could have then affected the other things that I was looking
Yeah.
at. Or maybe that was that puzzle piece I was missing earlier.
Yeah. And I think too that we can have people who are maybe feeling like they're going to be shamed for something they say, like how they got injured, or people who work in an industry that we may say that's not a healthy industry. So they're not going to lead with it. They're not going to lead with, I had this happen to me because I was assaulted in some way, and that's why I'm injured. They don't want to lead with that because that's scary. But then they spend an hour with you and they're like, I can tell her this. Where for you, you're like, okay, I would have loved to have known that at the beginning, but it comes up late. So then you're working on, how am I therapeutic for a few minutes,
Right.
because your session's almost done.
Yeah.
And how do I hold space? I mean, I think that's about holding space. Boy, we went down that route.
Yeah, and all of a sudden we're like, all right, all the things. Well, circling back before we go, I know so many things, but and I think it also just helps because like healthcare, we're like sharing the experience. But from your journey, is there anything you would share with someone who just got newly diagnosed with rheumatoid arthritis?
Yeah, I would say, first of all, don't be scared. When there was a point when I was pretty far into this where I looked up like how long people live with rheumatoid arthritis, and I'm already past that.
Right.
And like I said, they said, I think 10 years in women typically in their early to mid 60s. But I'm already on year 14, and the first 10 years were no big deal. So, and I'll be 62 this year. So I feel like when we have a diagnosis, we do decide like, how do I live with this? This is part of my life now. I several times have really felt like I'm going to meditate and I'm going to figure out how to get rid of this. And so far I've not been successful, but I do like that thought. I do like the thought of, can I heal myself from rheumatoid arthritis? Is there a way that I can? And traditional medicine will say, no, you've got it. You've got it. Okay. So then how am I going to live with it? What works for me? You do want to start to pay attention. When do I not feel well? When does my rheumatoid arthritis kick up? Like, what is it for me? I know it's this season, it's spring in Arizona. And as soon as it gets really hot, I know everyone's like, oh my gosh, it's really hot. And I'm just like, oh yeah, it's really hot. It just helps me. So I know that. So then what do I do? Well, I wear a lot of times, I don't have them on right now, but little fingerless gloves. I keep myself warm because that helps my joints. I often am in long sleeves or a sweatshirt, even when it's got in warmer, because for me, it just helps me to be warm. That helps my body. I look at what is going to make me flare in terms of what I put in my body. And again, that's paying attention. To your point, you could do a journal and notice, here's what I ate, here's how I felt. When I was younger, before I had this diagnosis, I could literally sleep like 5 hours a night and go for years. I'm not saying that's healthy, but I could do it. And now I'm like, no, I need a regular amount of sleep. I need to eat certain things. I need to pay attention to what I'm eating. As I said, I almost don't drink alcohol anymore. If I wanted to drink alcohol, I would, but I don't think I could drink a lot of that without it impacting my rheumatoid arthritis. And if that was a no-go for me, if I'm like, I can't give that up, I have a daily glass of wine, nightly glass of wine, then I just have to figure out, well, how do I offset it? And so then when I'm in a flare, I do have to figure out, how do I get out of a flare? Because if you can't figure out how to get out of a flare, I kid you not, last year in this season, I went into a flare and I was committed to driving my granddaughter, picking her up, driving her to her home, and then driving myself home. And it was on a day when I started down here at 6 a.m. So I was driving like over 100 miles and I couldn't get out of the flare because I was just driving. It was, and it's sitting. It's that sitting that, I'm in that one position. It's not like you have a lot of room to move around. So once you're in a flare, you have to figure out, how do I get out of this flare? What makes me get out of it? What do I need to do? For me, I have to cancel stuff if I can, and I have to sit around more, and which is against my nature. My nature is to keep moving. So it's really looking at how am I going to live with this, and also honoring, hey, it's your unique path. You have rheumatoid arthritis. Be a rheumatoid arthritis warrior. Show other people like, yeah, you can teach yoga. You can do what you want to do with this illness and not let it be the defining thing in your life.
I love that. So that's perfect. So yes, I always say don't go on Google right away. Like don't.
No, I was probably like more than 10 years in when I looked up, how long do you live with rheumatoid arthritis? Because I was like, I feel like I'm just kicking right along here. I'm like, what's the, and I did look that up, but I think I was past 10 years when I looked up, and it said usually 10 years. I'm like, okay.
I mean, I can't summarize. You just said it perfectly. So I was like, when you had first said like you looked that up, I was like, don't go on Google. As soon as some people get a diagnosis, they're like, "Rah," and then the panic, right? You get the panic cycle and you
Dr. Google. Yeah.
Yes, but I love that. I love that you recognize, you looked for your pattern. You're like, you know what? If I can meditate and get rid of this, but like, how do I manage it? How do I not let this define me?
Right, for sure. Yeah. Yeah, it's just part of my life story. It's not the life story.
Right, because you were so many other things.
Yes. Yeah.
Well, I feel like that's a good way for us to end. We've done the rabbit holes.
We did. I know, the two of us down that rabbit hole together.
So, but again, thank you for listening. If you have any conditions or journeys that you would like to explore, you want to feel free to message. Always feel free to follow on the socials. Thank you, Julie, for taking the time. We really appreciate you sharing your story, and we will talk to you soon. Thank you.
Bye-bye.
Thank you for tuning into today's episode of the State of Healthcare podcast. We hope that you were able to gain some valuable information or at least some insight into what goes into some of these conditions from this patient's story. Please feel free to always share. Please follow us online at Better Fit Therapy. And again, if there's any conditions or things that we haven't addressed or that you might find interesting, you can always message us online and we'll be willing to investigate. But again, taking your own healthcare into your hands is probably the most important lesson that you can learn from this. So unfortunately, in the state of healthcare that we're in now, you do have to fight for the things that are important. We encourage you to take a more active role in your healthcare and be able to participate so that we can fix this system where we're at now. Thank you again and have a good day.